Welcome, everyone. I'm Rohan Jeyarajah. I am a hepatobiliary and foregut surgeon in the Dallas-Fort Worth area. Today, I really wanted to just talk about what makes me tick and what makes me really understand my place in the patient care realm. Spirituality and medicine. It's got a lot of, rings, dings, bells, whistles, etc. But really, what does that mean to me? Well, I think the best way for me to begin this is by talking about how I think I spent a few years of my life thinking that I was God. We come through training thinking that if we, as the doctor, started the antibiotics and the patient got better, it was the antibiotics that we started. So we always have this positive reinforcement that we are God, that what we do makes the difference. Well, at one point in my career, I had a really difficult outcome with a patient. And I was so concerned about why this was happening to me when I had done everything I could as the surgeon to take care of this patient. What I felt was this feeling that stated it's not about you. And whomever you want to call him, her, or the tree, that was the sense that I got, that I was not in charge and that there was a much greater plan. It actually made me a much better husband and father and doctor, I think, because I realized that I could do the best I could do. I could do everything perfectly in my mind, but yet there was a much greater plan. I went home being a better father and being able to leave work at work, trust others around me, trust in a greater plan. And so from that day forward, I really have changed the way I've approached things. So I try to do things as well as I can. And I look for openings with patients to talk about spirituality. And again, it's sort of like that old saying, when you're under fire in a trench, you believe in God. And so again, being very respectful to all forms of faith, because I truly believe there's energy and strength in anything that you believe in. I think that we should be drawing from that as surgeons specifically. Putting this in the context of a much greater plan helps me so much. So how about being in the operating room? I was doing a Whipple one day and I actually had a major tear in the portal vein. And I put my finger on it and I looked up at the ceiling, and my resident actually jokingly said to me, "What are you doing? Praying or something?" And I said to him, "Actually, I am." And he was just horrified. And because we as surgeons never show that we're vulnerable, I was really scared at that point that I could lose control of this vein and lose this patient. And I needed divine intervention. I am not the boss. I work for somebody much greater than you or I. So for that purpose, it helped me so much in that moment. I had strength, whatever, again, you might call him, her, or the tree. And we were able to continue. Some call it weakness. I call it strength, knowing that you're not in charge. So let me leave with my favorite saying. Surgeons come in two flavors. Either they think they're God or they know they work for him or her. Thank you so much for spending time with me today.